Good afternoon, everyone. I'm Janice Whitaker, CGNE Administrator and Education Program Manager. It's my pleasure to serve as host of the CGNE Seminar Series, along with assistance from Jenny Rank, CGNE Education Program Specialist. This program is being provided by the Teresa Neese and Helen Diskovich Center of Geriatric Nursing Excellence at the Penn State Ross and Carol Neese College of Nursing, in collaboration with the Office of Outreach and Professional Development, the Center for Nursing Research, and Age Friendly Care Pennsylvania. Today's seminar, What Persons Living with Dementia Want Their Care Partners to Know, will involve a slightly different format than our usual. Brenda Roberts, Executive Director of the National Council of Dementia Minds, will introduce herself and then our amazing 4 panelists. She'll also share a video. They'll share some comments, and then we'll open it up to questions from the audience. So please be prepared to share any of your comments or questions into the Q&A feature today. But before we begin our seminar, we do have some announcements and disclosures to make. Penn State Ross and Carol Neese College of Nursing is approved as a provider of nursing continuing professional development by Pennsylvania State Nurses Association, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. Participants with a valid RN license that attend the entire activity and complete the post-event evaluation within 1 week can earn 1 contact hour. Partial contact hours are not awarded. Certificates will be emailed to RN participants meeting all requirements within 1 month following the seminar. As a reminder, we do record our seminars, and today, instead of using the chat feature for your questions, please enter your questions into the Q&A feature on your screen. You can also raise your hand and Jenny will unmute you so that you can share your comment or question aloud and engage in discussion today. The post-event evaluation link will show up in your browser when the webinar concludes, and it will also be emailed to participants within 24 hours. We do require this for RNs that want contact hours, but we do request that all attendees complete the evaluation tool to assist with our data collection. If you have any questions or comments, you're always welcome to reach out to cgne@psu.edu. And with that, I'm going to turn it over to Brenda to introduce herself, share a video, and introduce our panelists.
Awesome. I was kind of giggling there, Janice, because there were an awful lot of acronyms at the end of it. I'm like, okay, all righty then. I guess she knows what she's talking about. But thank you. And thank you, everyone, for joining us today. As Janice said, I'm the executive director. I have the privilege of serving as the executive director for National Council of Dementia Minds. We are extremely proud to be the first national nonprofit organization that is founded and governed by people living with dementia. My husband is one of the founding members of the organization, and he was diagnosed with vascular dementia in 2014 and continues to live well with dementia. So as Janice said, the next thing on the docket is to meet our esteemed panelists, and I'm just going to call on them in the order I see them on my screen. And Kelly, that's you first.
Okay, I'm Kelly Miller. I live in Billings, Montana, and I was a registered nurse for 35 years. I've been married for 36 years and have 5 adult children and 2 grandchildren. I was diagnosed about 3.5 years ago with young onset Alzheimer's. My mother also, she died at 63 from young onset Alzheimer's, and my great grandmother also had it.
Awesome. Thank you, Kelly. Mia, you're next.
Hello, I'm Nia Mostasero. I live in Meridian, Idaho, right outside of Boise. I served in the Air Force for 23 years and retired in 2017 due to some of my cognitive impairments. I was diagnosed at that time with early onset Alzheimer's. I've since moved from I moved from San Antonio to Idaho in 2021, and in 2022, my diagnosis changed to chronic traumatic encephalopathy dementia.
Awesome. Thanks, Nia. And part of the move was to be my grandkids, right?
My grandbabies, yes, my two grandbabies are here. So.
Yep. Yep. Life doesn't begin, right, Kelly, till you're a grandma. Yep. Awesome. Okay, Gary, you're next on the screen.
Good morning or afternoon. I'm Gary Schmidt. I live in Green Bay, Wisconsin. I'm a retired family practice physician who served as a medical director for a long-term care facility that had multiple levels of care, including 2 cognitive units, independent living, skilled care, rehab. And my office actually for the last 5 years was within that building. So I got to work in their home. Uh, I was diagnosed with dementia with Lewy bodies somewhere in 2018, 2019. And been active with this group and Lewy Body Dementia Association and the ARDC in Wisconsin. These are
You're a busy educator and advocate, right?
we try to be. I try to be. I'm not plural. Yes.
Most days you're not anymore, right? Awesome. Thanks for joining us, Gary. Okay, Arnie, last but not least.
Thank you, everyone, for the invitation to be here. I'm Dr. Arnold Barish. I live in White Lake, Michigan, which is about 20 minutes outside of Detroit. I'm a retired podiatric foot and ankle surgeon. I was diagnosed in 2015 with mild cognitive impairment, early onset dementia. That has kind of slidden now to where I have mixed dementia, including Lewy body dementia.
Well, we have a great panelist with various types of dementia, so we should be able to address lots of different questions that you might have. So the next step is we're going to watch the video that features folks living with dementia who are talking about what they want from a care partner. After the video, I'm going to ask the panelists to make a few comments and expound upon what we watch. And then it's your opportunity. I'm guessing that every day you don't have the opportunity to ask folks living with dementia any question you want to ask them about being an effective care partner or anything else. So this is your opportunity to do that. So we are expecting the Q&A box to blow up as well as the raise my hand and interact with us. But Jenny, if we can have you share the video first, that would be great.
For me, I have been a caregiver and I have a care partner. For me, the difference is as long as I am able, I should have a care partner to help me with decisions. When you become a caregiver, which I will need, when I can no longer make those decisions for myself and somebody has to make them for me. Where with care partner, it's more of the two of you or three, however many, working together as a team. For me, I would much rather have a care partner than a giver because that means I'm in a better place.
A caregiver to me is somebody who is taking direction from somebody else. They don't necessarily directly know your wants, your wishes, what you can or can't do. They're being directed by a third party, especially if you as the patient can't communicate or they don't understand how you communicate. A care partner is somebody closer, oftentimes a family member, hopefully a spouse that you have discussed things with of what your wishes are.
Oftentimes, when we first get that diagnosis, the people around us get the diagnosis as well, and so they want to jump in. For example, in my household, my daughter's an RN, and she instantly wanted to take over my life. My daughter-in-law kind of did the minimizing. Oh, that happens to me, trying to make me feel normal. That happens to me all the time. So this went on, and it was just a vortex of craziness. So I had my psychologist come to my home and sit at the table with all of us in one spot. And she facilitated because we had talked about things I wanted to bring to the table. And one of them was the minimizer. One of them was talking about the denial, which is a normal process, but it shouldn't last forever. And then, for my daughter, I was able to kind of really get across to her that there's going to be a lot of time down the road that I'm really going to need your help. But for now, let me be independent. Let me make my blips and my mistakes, because in the big picture, they really don't matter.
My main care partner is my wife, Tracy. And the beautiful things that she does is she allows me to stay in my routines. My routines are extremely important for myself and probably most of us to stay within our routine. So she allows that. The next thing is she understands I have a better day if I start my day off by going to the gym, getting that natural oxygen rush to my brain. I feel a lot better. My vision feels stronger. She also understands noise is a big complication, I guess, for me when we go into restaurants or we go to different events. We'll walk into a restaurant and she'll look around and she'll hear the noise. She'll look at me like thumb up or thumb down. And then she'll go up to the waitress like, is there tables outside? There's less noise, no speakers going on or whatever. So I really appreciate that.
I would say, like, as far as like caretaking, that in our early stage to moderate, that you don't be too overly observed. You have to do things, as many things as you can, make errors on it, and they will let you know. But to give you the space to be free. If you be so over the shoulder, it drives us nuts. But if you just give us the freedom, once you get that diagnosis, you have to believe in yourself and be confident. Breathe. When as we progress, things we're not going to grasp like we used to, but early those that is just starting, to make sure that the understanding, respect me. Give me this. Let me do this on my own. I don't need you to help me with that.
I do have 9 siblings, but they live so far away, so I cannot really rely on them. However, in my community, I do tell my neighbors and my friends that I do have dementia. And I am so blessed in the sense that they understand the issue. And I have to say much more than my brothers and sisters, because they are in a state of denial that one of their family members do have this really stigmatizing illness, disease, sort of. So what I do is I consider them my care partners because whenever I need something, they are here, always able to help. I'm no longer able to look at my computer because whenever something goes wrong, I don't know where to go. I'm so lucky that the couples, the people that live in a townhome near my place, are always willing and available come over for half an hour and whatever. And recently, we had a little bit of a snowstorm, and of course, I no longer can shovel my sidewalk. And without being asked, next door neighbors they came, salted, shoveled, and salted my sidewalk. I consider this part of the dementia-friendly community, and next door neighbors, I feel like they are here to help if they know that I do need it. So as somebody said, how do you don't look like you have dementia? Yes, that is true. But if you tell your next door neighbor that occasionally you may need help, they're most willing to help. Thank you.
Although I live alone, I have people that are pretty astute to my habits. I'm usually 30 minutes early to the gym. I have a workout partner, so I beat her there. But today I was 5 minutes late, and she said, "You had 7 minutes, and I was going to call the police for a welfare check." And I fell asleep. Another story is I have a good friend, Monica, who's in our Black Dementia Minds group. I fell asleep in one of our Zooms, and she tried to call me, I guess, and I didn't answer my phone. And she contacted my son to come and check on me. So although I live alone, I have a lot of people that are very keen to my habits, and I'm blessed for that.
With my PCA diagnosis, what that basically translates into is visual spatial. So I can't drive, and I just have this tendency of kind of turning the wrong direction, the opposite direction of what I intend to do. So it's not a big deal, but what my friends do is when they're driving me places, or even my husband, they point, okay, that's where I need to go to get in the car.
Our society has not defined living with dignity and quality of life. There is no real definition for it. So that makes it even harder for anybody to relate to it, because what one person sees as quality of life, another person does not.
Which is hard too for like Mike being my care partner. He wants me to go out and do things. I don't want to. I've never wanted to. Even before this, I've not wanted to. He doesn't think my quality of life is as good as it could be. If you want to get me ticked off or pushing back, try to get me to do something I don't want to do, because it will irritate me and it will make me stand firmer on my stance. I don't know why that is. That's just what I do.
Awesome, if I say so myself. Great information. So I'm going to turn to the panelists now and see if they have additional comments that they want to make since they've watched the video about care partners, caregivers. Monica. You just talked about Monica in the video. Nia.
Hi, I'm Nia, and I just wanted to kind of touch on the space from not having, from being single. I did have a mate, a fella, and we broke up in August. But my idea of care is whoever my spouse is in the future, or whoever, they would be my care partner. So I have it to where there's a clean delineation between my care partner and caregiver. My caregiver is the person that is like my nurse. My home health nurse, they'll do all the medical stuff, making sure I'm taken care of from that aspect. I don't want my care partner or my spouse to do any of that stuff because I don't want them to get burnt out. I just want them to make sure that I look pretty, my makeup is done, my hair is done, my outfits match, I'm eating well, I'm clean, just, and that I'm sitting on the porch drinking lemonade. I don't want my care partner to be overwhelmed doing the caregiver duties.
I'm thinking I could move in and be your care partner. I'd be sitting on the porch with lemonade. We could do hair and makeup. I'm just totally fine with it, Nia.
Let's do it. Let's do it. It's a date.
That'd be so awesome. Thank you. Arnie, you're next.
Um, we've all heard panelists, and we all have different stories. Nia, who is living alone, Gary, who has Lewy body, and myself have Lewy body. My situation is a little bit different. Michelle and I have no children, and we both have, call it terminal diagnosis, where Michelle has fourth stage metastatic breast cancer, and then I have Lewy body dementia. So it becomes, who is the care partner when? Because we're basically care partners to each other. And some days, if we wake up and we're both having a shitty day, it's a matter of who's crawling out of bed to make breakfast or to do this, that, or the other things. So, as everybody described, care partners, caregivers are different. But Michelle and I kind of fall in both categories. And we've, designated, through our get your papers and your affairs in order. We have had a challenge doing that because we don't have children. Michelle was bright enough after I was diagnosed to move us back to Michigan. And as Brenda knows, I hate winter. And we were living in Virginia before, where we had 4 seasons, but very minimal problems. And being back with family has made a difference to us. But within in the family, even in community, some people understand it. Some people don't want to understand it, and some people just don't get it.
I love what you said too, Arnie, about, you guys really define care partner because you're caring for each other on any given day. And I know as a care partner, I used to brag about that term, that we were a care partner, not a caregiver, but I did have to learn that I was the partner and I needed to allow him to care for me too, even though I don't have a terminal diagnosis, right? So that's kind of the whole care partner thing too. So I appreciate that. What you got, Gary?
Well, my care partner is my wife of 50 plus years. She's a retired nurse who worked in hospice for a long time. So she's aware of taking care of people with terminal diseases. But she's now living with someone who makes mistakes, says things he shouldn't say. And it's taken a lot of patience from her to be able to live with this. It's hard. And as much as I try to be gentle and understanding, I sometimes slip up. We all make our sins. And she's very patient. We're learning. It's a transition. And we just got back from a trip, and I found that I required her assistance more than before. And I don't drive either. I've learned that I have to be careful what I say sitting in the right-hand seat of the car. That often leads to arguments because she's an excellent driver, but she doesn't do things the way I may have done. I've been very open with my disease to my family. to neighbors. We don't have a close neighborhood where everyone knows anyone, but when I first got the diagnosis and we moved into this new home, I went around and met people and said, I'm Gary Schmidt. And they introduced themselves. I said, well, I have Lewy body dementia, and I'm not going to remember your name. So next time you see me, tell me who you are. I'm not at this stage yet, but you may find me wandering around, not knowing where to go. And if you see me doing that, just point me in the right direction. Well, I had one neighbor with a smile on her face. She said, I will never tell you that. You're coming down here to mow my lawn. So yeah, so it's they understand. They know who I am. They see me walking by and they wave. And I try to be open with them because I try to educate everybody.
Awesome. I love that you're here to mow my lawn story. Again, I could be your neighbor. You could come down and mow my lawn while me and I are having iced tea on the front porch. We got it covered. Oh, Kelly, what you got?
Trying to think of how to say this. I wish I had known as a care partner what I know now when I was helping to care for my mother, because dementia is very different from the inside out than it is from the outside in. Because of that, I try really hard to be very open with my friends and family about what it's like. I try to describe to them how it feels and like how I would like to be treated. Um, and just try to be an advocate for other people with dementia to help to describe what it's like. I don't know how else to say that, but I am grateful that I've seen both sides of it, and it's not nearly as scary or um, intimidating as I thought it would be.
That's awesome. That's awesome to hear. And it's interesting because when you said now you've seen it from both sides, and Gary basically says the same thing too, in terms of he was the physician, now quote unquote the patient, he was, and then you were the care partner. Now you're on the other side of the care partnership. So to have both points of view is interesting. Brings a whole new perspective. Mia, you've got your hand up.
Yes, I wanted to also talk about something that I've created. I've created a care squad. Arnie made me think about this. I have a care squad and I have a death squad. My care squad are my two best friends that will assist my son with anything that he needs. And they're in my advanced directives, my will. I have instructions for everything just laid out in a binder for them, and they all have the same binder. And then I have a death squad that is one of my good sisters as a forensic scientist. She knows how to do all the stuff with the brain donor and everything that I need once I pass away with my body. She will take care of that. So for the care partners, I guess I say this to say, don't be afraid to enlist help. And actually give them instructions on, hey, this is what you'll be doing in this role in the future when this happens. Doesn't always have to be children if you don't have any.
Right, absolutely. I love it. You call it your care squad, your death squad. And so, yeah, as care partners, we often hear about how important it is for us to develop our team. And I never played a sport when I was in school. So as a care partner, I'm like, hey, I'm on a team now. I'm developing my team, for the first time in my life. And that is really important. So thanks, Nia. We do have a couple of questions. First one's to you, Nia. Nia, I appreciate your resilience in sharing your experience. Do you have a schedule, a diary, or some form of alerts that signal to your care networks when you need help since you live alone?
I have, oh, that's a great question. So we have text groups established, and I check in when I'm having symptoms. I let them know when I'm having symptoms and when I need something, if I need anything, so that they're ready. So that's how we communicate is through our text chain, our text group. Mhm.
All right, next question to everybody, and Gary laid the groundwork a little bit for this for us, is do you feel pressure to self-disclose your diagnosis to others, such as your neighbors or people you interact with in your community? And what is your preferred way to disclose your diagnosis? Oh, look at the hands pop up already. Arnie, what you got?
It's a it's a very personal situation. Um, some people choose to just tell their family. Some people just tell their friends to help them. My situation's a little bit different because I suddenly disappeared from the forefront of what I was doing at the hospitals and things like that. And unfortunately, in medical community, when somebody tends to disappear, they automatically think that the person has cancer of some type, and the lifespan is shorter. They don't see the the onset of the dementia or Alzheimer's because it starts earlier and the symptoms take a longer time to recognize. And most of us recognize the symptoms we have ourselves prior to many other people recognizing them. And of course, now tools have gotten easier for diagnosis, which is great, but there's still no great treatment, and there is certainly no cure. So it makes a difference who you tell, when. And those people that are close to you and truly friends step up. You'll find that some of your friends don't know what to do, so they step away. So it's a hard balance, and there is no guideline of who to tell when.
Great. Kelly, what you got?
I'm ending up talking about my mother more than I thought I would, but uh, when my mother was diagnosed, it was very embarrassing to her. She'd never shared it with anybody. And so people were just left wondering what was wrong with her, really. Um, and I think based on that, I made a decision to be very open with it. And I do think just my background in working with people with handicaps and illnesses and everything, people do better when they understand something. So if you can help somebody understand something, they're going to deal with it just fine. It's the ignorance that makes it hard to deal with. So I mean, I don't tell everybody if I'm checking out at the grocery store. I don't tell the checkout person unless I need help with something. I, but my friends and family and anybody else that would want to talk about it. I wear my Dementia Minds t-shirts out, and sometimes people have questions and things. I think it's really important to for people to understand that we can live well with dementia, and that it's not scary. I went to a CPAP appointment the other day, and the respiratory therapist said, "Oh, my daughter thinks I have, Alzheimer's or something." And it just was an opening to have a discussion and for me to encourage her to seek, a diagnosis or rule out other things. So it's not a bad thing. And I think the more we talk about it, the easier it is. I do have one friend that she was kind of I guess she just doesn't know how to deal with it. We actually went to high school together and nursing school, and we've been friends forever and ever, but she just doesn't know how to deal with that with me. But she's the only one. Everybody else is 100% great. And I just give a quick little speech that says, I basically, if I forget something, I do have Alzheimer's. It's no big deal. I just want you to know you might have to repeat something, or you feel free to tell me if I repeat something, and we'll laugh about it together because I still want them to give me a hard time for forgetting something. I mean, they're my friends. And once you give them that permission to talk about it and laugh about it, it just goes away.
That's awesome. That's awesome. Gary.
Well, I'm the opposite. I'm too open. I'll tell anyone and everyone what's happening. And I think, especially when you're with a group of people who you're having conversation with, they need to know what's going on, because there's going to be lapses in the conversation, and I'm not going to be able to keep up. Or I may say something that is inappropriate. And I need them to understand what's happening. Uh, I wear a lanyard when we travel now. It's the sunflower. I think it is the sunflower, the hidden disability. So let people know that if I get lost, they can help me. Um, Another story I tell about is I tell waiters and waitresses what's going on because I may not understand what they're saying. I may take longer to make my my orders. So I think it's important that people know who you are, so that you can live on a daily basis, so they know what you're experiencing. Uh, yeah.
And when you disclose, it's things like, sounds like it's been positive. People respond. I mean, what Kelly shared and Mia shared, it sounds like it's pretty positive when people know when you tell and share them.
It is. I like everyone has. I have a friend who, when I would ever tell him he's still doing this, well, I have those problems too. I like to turn around and say, maybe you need to get a diagnosis, but he doesn't.
Mhm.
Had a long conversation with a waiter in Florida who brought me white wine instead of red wine, and I had ordered the wrong wine. We got back. My wife, I'm sitting with my wife. I said, "Thank you for being understanding. I have Lewy by dementia. This is what I'm going through." And she says, "You don't need to tell everybody that." But it was just sort of,
Yeah.
it was
Well,
spontaneous.
well, that's okay. My husband wears a button and wears it religiously, says I'm living with dementia. And so he doesn't have to tell anybody. He's got a sign on that says it.
Yeah.
And people chat with him and talk with him all the time. It's an icebreaker. So
Yes.
thanks. Thanks. Arnie.
Sometimes it is a family dynamic, and oftentimes it is a difference in religion and nationality of who you may or may not tell. Some religions will not will not recognize it. And therefore, if the person living with dementia isn't allowed to say something and the family doesn't say something, it's, just, oh, well, Aunt Tilly's in the closet. We just roll her out for, holidays. Um, so that dynamic has to be looked at also. It's like what Gary was talking about a restaurant. If Michelle's not with me, I will go to a certain one or two restaurants that know me so that they will take a little bit more time with me. They know that basically I can't figure out what a tip will be. So I will usually ask them and just say, hey, will you add a 20 or 25%, 30% tip, to the bill? And I've never had anybody take advantage of me and put a 90% tip on the bill.
I know.
So those are just, my, few additions to it.
Mhm. Yeah. I mean, really, the majority of people in the world are really good, honest people are, at least that's been our experience. They're willing to support us when we go out and share. I love this next question that's in here. And it was asked by an anonymous attendee who I just want to say you shouldn't have asked it anonymous because it's the best question so far. Do you think that the public has an accurate idea of what dementia truly looks like on a daily basis?
No, not at
Whoa.
all. Not at all. You
Oh,
know,
that's a
I,
big response
I,
from this.
I remember talking to a neighbor across the fence and telling her what I had, and I told her all this. I have Lewy body dementia, and we have a lot of physical symptoms. And she says, "I didn't realize that people who have dementia have physical symptoms. I thought they were just confused." And there's a difference between dementias too, and how we respond to things. If you have Alzheimer's, you're living in your own world. If you have Lewy body dementia, as I do, I understand everything I do wrong. I know what happens, and I think it's harder I think it's easier for people with Alzheimer's than it is for people with the other dementias who are aware of their frailties and mistakes.
Hmm. I'm going to ask Kelly what she thinks about that because I bet Kelly is aware of mistakes she makes and stuff. What do you think, Kelly? Oh, this
Yeah.
is point counterpoint here. We're going to get a debate going.
um, I like what Brenda always says. If you know one person with dementia, you know one person with dementia. I don't
Yes.
think we can make blanket statements about any of them. And I think you heard just in our introductions, there were people that were diagnosed with Alzheimer's at the beginning and now they have something totally different. I don't really care what the diagnosis is. When you meet a person, you just need to figure out what that person is like, not try to make it a blanket situation. Um,
Mm.
I'm sorry if I generalized, Kelly.
no, it's okay.
Well,
I,
you threw that bait out there. I had to hook it, man, bring it
I
in.
wasn't gonna say anything. Brenda egged me on.
Everybody's experience is different, but Gary, you made an excellent point in terms of so many people just assume it's memory, right? It's just memory. That's all they think of in relationship with dementia. You talk about the many, many, many physical components that come with it as well. So now that I threw Gary under the bus, I'll move on to Arnie.
You throw him under the bus too, please.
He's next. He's coming with you.
Always glad to be with Gary. It's like, there's a bear behind us and running. All I have to do is be a little bit faster than Gary.
Yep.
Uh,
Don't have to be faster than Bear, just faster than Gary.
yeah, it doesn't make a difference at what education level people are at in recognizing dementia. A scary story for me is I was supposed to have some surgery done, and I was in pre-op, and of course, filled out the same paperwork 22 times. And the anesthesiologist came over and talked to me and looked at it and said, "Well, I know what dementia is, but I've never heard of Lewy body dementia."
Oh,
Well, you want something scary because Lewy body is one of the major ones. You have to be careful of the type of anesthesia that you were given. And unfortunately, for some reason, pre-op, they wouldn't let my wife come back with me because that was one of their policies. And if she had been there, I probably would have gotten dressed and left. because after I mentioned it to her, I saw her scurry to the nurse's station and I could hear her clicking on the computer. And I was assuming she was looking up Lewy body. Fortunately, the nurse that was there, put her hand on my shoulder and said, "Don't worry about it. I know what it is. I have a family member and I'll make sure of some things." So um, education level doesn't always define what people know. And a lot of times the first person contact at in any type of facility is a nurse's aide or a contact person rather than it being an RN or a physician or an OT or a PT. And they can help drive the bus as long as they are listened to.
Absolutely. Absolutely. What you got, Nia?
So one of my mantras is I do not want to look the way that I'm feeling or look the journey that I'm going through. So I always talk about how my insides don't match my outsides, and I use it to my advantage to advocate because I know I don't look like dementia. I know that, but I do pageants, I model, I do all the things, but I also raise awareness while I have my foot in the door.
Yeah, that's so awesome. That is awesome. We have another great question. And Donna, so Donna asks, well, first of all, she says, your reflections are absolutely wonderful, and she appreciates your openness. She wants to know what can healthcare professionals do to decrease the stigma with students and our community. And I'm thinking this is like a question that y'all like. What can healthcare providers do to help reduce stigma? Any ideas?
I would say, being a previous healthcare provider, is know what you're dealing with. Educate yourself first. I When I was working in the nursing home, I thought I knew what dementia was, uh, but I found out I really didn't know. I do now. So I think we just have to be aware of it. Uh, don't treat a person who has dementia as if they're, quote, demented, unquote. Uh, do that in the community. Let the world know that the people who have dementia don't look like people who have dementia.
That's why we at Dementia Minds use pictures so much. We love to use pictures because you all hear all the time, but you don't look like you have dementia. We're saying this is the face of dementia. So Nia, you're next.
I would say, or I am saying, I would encourage the students to leave their biases at the door, to realize that they don't know what they don't know, and to come with humility and learning. Because every person that has Alzheimer's is not going to be the same. They're not going to need to be treated the same. I have CTE. My TBIs are in different places than maybe someone else with CTE. So my brain is affected differently. My capabilities are affected differently. But if you come into it thinking you already know, then that's going to affect the care that I receive.
Absolutely. All righty, Arnie, what you got?
The major thing to me, for anybody lending care to somebody that has dementia, is to listen, because we are not all the same. And if you stop a minute and you listen to the person, you'll get a much better idea of them. And 95% of the time, you will have a better idea than the doctor will, because the doctor only has a few minutes to spend with you. because of the way our system is set up. The other thing that is a negative is that when people see dementia and Alzheimer's, a lot of their information is from books, from TV, and we are depicted in the end stage of it. Even most recently with Bruce Willis, the program that was on him and the book that was written was done very well because it showed him going through the phases. So it's not that we are suddenly all sitting there just in a wheelchair and drooling on ourselves. So that's one of the biggest stigmas that we are all trying to change at every level of healthcare.
Right, and that goes back to that earlier question about disclosing. We've talked in our group so much that people only see end stage because so many times people don't disclose in their early days that they have dementia. And so people are living shoulder to shoulder with us and we don't recognize it as dementia. It's when they can't compensate for it or cover it up anymore that then we see it. And then Arnie, you said listen to and talk to the person. So the doctors listening to you and talking to you could role model that to others as the way to do it. So Kelly, what you got?
I love that, Arnie. Thank you. A couple of things. I think that any healthcare provider has a responsibility to be open-minded when they meet somebody new, and I don't care what it is that they have. They are not their diagnosis. Everybody responds differently to things emotionally and to illnesses. So I think you've just got to be open-minded. I always hated getting report on when they would add, oh, so and so is such a pain in the butt, or you go then in there with a preconceived notion, or even a diagnosis can be the same thing. So just meet people and make your own assessments. Um, One thing I can say about all of us, because there are hundreds of us that meet together, and one thing I've learned about meeting so many people with dementia is that they're intelligent people, all of them. I feel like it only strikes people that are intelligent, and we're still here. We're still on the inside. We're having a hard time communicating our intelligence to the public, but they are still intelligent, so still treat them like they're intelligent. The other thing is that um, I would want people to remember that they're the patient advocate, not the hospital advocate, not the doctor advocate, not the family advocate. You are the voice for your patient that has dementia, and they may not be able to communicate that as well as someone else. So that's a responsibility that remember that the patient is the one you're working for.
Oh, I love that. I love that, Kelly. Thank you, thank you, thank you. I see Arnie's hand up, and then I see Janice's hand up. Janice is probably nudging me like, Brenda, we're about 5 minutes out. Is that what you're doing, Janice?
No, I actually have a question.
Oh, okay.
Oh,
Well, Arnie, should we let her ask her question?
Absolutely.
All right, go for it, Janice.
Thank
It'll
you,
probably be
Arnie.
our wrap-up question. I'm just saying.
It actually is to an extent. So one of the initiatives that the state of Pennsylvania and in our own local community here in State College, Central Pennsylvania, is working towards is creating more age-friendly and dementia-friendly communities.
oh,
And so I'd like for each of you to share what you would describe. Someone earlier, I think it might have been in the video, said, the quality of life is not specifically defined in our society. I think, Arnie, you might have said that in the video. I'd like for each of you to describe what you believe to be a high quality of life for a person living with dementia, for yourself. As well as if there was one thing in your community you could change to make it more dementia friendly, what would that be?
Okay, so what do you want them to answer, Janice? She has two questions there, one
Yeah.
at a time. What's your first question?
Yeah, so defining what quality of life would be like. And I thought they were kind of connected to each other, but
So
you
quality of
know,
life, what defines quality?
how would you define quality of life as a person living with dementia? And
Me,
maybe one change you'd like to see.
So I don't mind going first, unless Arnie wants to go first since you were waiting.
No, that's okay. Yeah, go ahead. My
Okay,
answer was towards something different.
okay. This is a perfect question for me because last week I solidified my assisted living facility that I will be going to. I did a lot of research and I decided on this particular assisted living facility because they have stages and they call them neighborhoods. So at first you'll be an independent living neighborhood, then you'll be an assisted living. That's where I'm going to be when I stop driving. I'm going to move into there. And then they transition you to the memory care once that's needed. So for me, I'm choosing that place because of the amenities and the quality of life. They have so many activities. They have a gym. I love working out every day. They have a very nice gym. They have more staff than they do patients. They have lots of engagement programs. I think that's the biggest thing is the engagement and not losing my independence because they have transportation. I can sign up and they can take me to see my grandbabies and pick me back up. You know, it's wonderful. One thing that I would change is I would change the stigma that it is age specific. I hated going. The only thing that I didn't like about being in there is for they had like movie time and it was Singing in the Rain, you know, and I'm like, I'm 51 years old. I'll probably be 55 by the time I move in here. Can we look at something like The Breakfast Club or Pretty in Pink? Like, we're moving you know what I mean? We got to move the dial and not make it seem like it's for such an older generation because it's not. We're catching up.
amen. I love it. I love it. What you got, Arnie?
What I was going to say went back a little bit. We're all talking about support groups, and everybody, if they get a cancer diagnosis, they ask what type. Most people, if you're diagnosed with dementia, we don't ask what type right away. We go to a really dark hole. And those of us in support groups, the first thing that is usually asked is, can you put me together with somebody that has the same diagnosis so it can help me learn what's maybe down the road? So mentoring, and I got this out of this month's Brain and Health, is actually more important than the support group because it tends to intertwine the two.
And I think in Dementia Minds, we do mentoring in our groups as it's wonderful to bring in new people to our groups. We love getting people the day after they're diagnosed, right? Connect them with the folks who've been multiple years out. And so Kelly, I'm going to let you bring us home and then I'll do a real quick wrap up. So you're making our closing remarks.
Choices. Choices give quality of life. We can act like children in some ways. We might sound like children because of how we communicate, but we're not children and we have a lifetime of experience and we're not a child that needs to eat their broccoli. We are an adult who can decide if we want to eat our broccoli or not. We have a terminal illness. It's not going to matter really. I wouldn't want to, I would want someone just to do what I would like to do and offer choices, simple, minimal choices. And also, I will not be going anywhere where I can't have a dog.
Oh, yeah, pets are important too. Yes. Well, thank you, thank you, thank you, everyone. Thank you to the attendees who are with us today. I want to mention, if you're interested in learning more about Dementia Minds, to visit our website at dementiaminds.org. We do have educational events on a regular basis, free of charge, that we call our friends and family, where it brings in discussion groups just like this with people living with dementia, friends, family, and professionals. So you're welcome to that. And better yet, if you know someone who's living with dementia who might benefit from joining one of our peer support groups, because in addition to education, we have peer support groups. So Janice and Jenny, thanks for making this happen today and doing such a great job.
Well, thank you so much, Brenda, Arnie, Gary, Kelly, and Nia for this tremendous discussion that you shared. We really value all the insights and the information and the ideas and care partner strategies that you provided for us today. So thank you so much for sharing these amazing insights. And I know everyone's learned so much. So thank you. And just a quick reminder to participants to complete the evaluation tool that will pop up in your browser when Jenny concludes the webinar. But you'll also receive it via email. So thank you so much in advance for taking care of that as well. Have a great day, everyone.